Hi, I'm Dr. Christopher Mullane, and I'd like to share with you the most common reasons or causes of carpal tunnel syndrome, and in my experience, the most effective ways of alleviating the problems associated with it. Now, carpal tunnel syndrome can occur due primarily to two reasons. The first being major trauma, and the second being minor trauma. Major trauma would be in the form of like a car accident where your wrist gets jammed into the steering wheel, or a fall where you try and brace yourself with your hands. Minor trauma would be more of the repetitive activities, such as clicking on a mouse constantly throughout the day, or lifting, or using your wrist to write a lot throughout the day. These would all be considered more in the minor trauma category. Now, I'd like to talk a little bit about the anatomy of the carpal tunnel in itself. So you have carpal bones, which are the bones into your hand, and you also have your forearm bones that kind of form the wrist. Now, across that wrist, there runs a ligament that forms a tunnel. Now, through that tunnel, you'll have nerves and tendons and ligaments that kind of run from the forearm down into the fingertips. So when these areas get injured, not only do they affect the nerves that run through there, but it also can affect the muscles associated with it and the tendons and the ligaments as well. Commonly, we see three primary complaints that patients describe. The first being they have pain in some form, whether it's sharp or shooting, or their pain shooting down to the fingertips. They have a numbing sensation or tingling in their hands and fingers. And they're also going to have some muscle tension or muscle spasms, whether it's in the forearm or the hand. And then finally, they're just not going to be able to use their wrists like they'd like to. They're going to have restricted motion. If they try and lift something, they can't use their wrists as they normally would, or even with their daily activities. So there are three very effective treatments that we like to use in alleviating the problems associated with carpal tunnel syndrome. These being chiropractic manipulation, electrical muscle stimulation, and the third being stretching and active therapy into the hand and wrist. The first I'd like to talk about is the chiropractic manipulation. Now, this is going to be applied to the joints into the wrist and into the hand to alleviate any pain, restricted motion, as well as any muscle spasms or tension that accumulates into that region. The second therapy is electrical muscle stimulation. Now, we can apply this to the muscles and the area into the hand and forearm, and essentially it'll help reduce the pain, the swelling, the inflammation that accumulates, and also just allow you to move your wrists a little bit more freely after this therapy. And then the third treatment we'd like to do is some active stretching techniques. What this will help do is alleviate any scar tissue that has formed, and essentially bring your hand back to a normal functioning capacity. So it'll reduce the pain, it'll help you become a little bit stronger and have a little bit more range of motion to that wrist, and also reduce any spasms that occur into the muscles and tendons into that area. So kind of in summary, we have three treatments we like to use, and when they're used together, they can drastically stop or reduce the pain. They can help you move your wrist a little bit more freely so you won't have as many restrictions, and you'll also reduce any muscle spasms or muscle tension or tightness that accumulates into that wrist region. So what does this mean to you? It means a few things. You can now go to work and work on the computer a little bit easier, maybe do writing or typing, and you just won't have as many restrictions or many problems as you would when you have the syndrome. The second thing you'll be able to do is you'll be able to do your daily activities a little bit easier. Especially when you're brushing your teeth or combing your hair, you're using your hands and wrists a lot to do those things. But also kind of daily activities around the house, whether to be any of the chores or lifting up your kids. Those are all going to be affected when you have carpal tunnel syndrome. And then the third thing that it's going to help is we're going to be able to help you sleep a little bit better, because when you have that syndrome into your wrist, sometimes you lay on your wrist and it creates pain and it wakes you up a little bit. So this way you'll just be able to have a better night's rest without so many irritations and problems into that area. So if you're struggling or having any problems with carpal tunnel syndrome, please give us a call so that we can help you relieve this pain. You can reach us at 803-599-5902.